And so 19 OB is the procedure, and these were the number of carbules given and at what time they were given for a total number of 2. And then we will complete this portion of the paperwork, the types of anesthetic that are written, and how many carbules were given during the procedure. If the patient were needed to have to go into the bathroom during the middle of the procedure, we could put like 12 noon right here for when they would have had to go into the restroom. Or if we had to give Gatorade towards the end of the appointment to make the patient more alert, we would write that in that area with food and drink. Now, prior to the appointment, we would go over with the patient at the sedation consult what to do before the appointment, what to do after the appointment. They would provide a name and driver if they have it. If not, we have a sticky note attached to each of these paperwork stacks, and the patient will provide their driver before we bring them to the treatment area. If they do not have a driver, they cannot be seen that day. And very important, prior to the sedation, the patient gives consent for anesthesia and for sedation and for any treatment that would be done on the day of sedation treatment. Again, it is very important that all of the sedation consents and extraction consents, implant consents, if we're going to place an implant, are done before the patient is sedated. Otherwise, you cannot perform the treatment that day because they will be coming to the office with a triazolam and a Valium on board from the night before, and then the triazolam an hour before. They cannot legally sign consents at that point. If they do not have a driver, you cannot send them home with an Uber driver, with a taxi driver on a bus, like a Lextran type city bus. They have to have someone that is capable and able of getting them into and out of the home. To also help us double check ourselves, this is used for in-house counting. This is not scanned into the patient chart at all, but we use these cards, what we call them here, as the top dose card. So we would put the patient's name, the date of the sedation, and then the team member that filled out the card. Typically, this is in our office, one of our assistants. We would have the top dose. The patient's top dose of triazolam is 8 tablets. So that's the maximum number of tablets they could be crushed up and placed under their tongue prior to starting the IV. In office, the patient could have 7 tablets because remember, they are coming to the office having taken 1 triazolam already. And then we know that typically we will not ever reach the 7 dose, so we will count out 4 triazolam from that cabinet that I showed you earlier, put it in a bottle, and just take 4 triazolam tablets with us to the operatory. We write down the drugs we could use during the sedation procedure. Hydroxyzine, the patient isn't a smoker, isn't a gagger, and no severe postnasal drip drainage. So we did not have to use any hydroxyzine. We just write 0. We didn't have to use any. Triazolam, we used 1, 2, 3. We gave 1.25 milligram tablets of triazolam during the hour before starting the IV, and we should count 1, 2, 3 tablets of triazolam. Versed, we drew up 10 milligrams total, 2 separate syringes, each coming from the vial. This is the vial number because they come in packs of 10. We label the vial number that we drew from, and we see when we count here, Versed 1 milligram, Versed 2 milligrams, Versed 2 milligrams dispensed. That's 1, 2, 3, 4, 5 milligrams. We used this whole syringe, so we'll initial over top that it was all used. This, what we do, we strike it and put back. Then we know that we never used this. We put it back into the vial. Here we used all 5 milligrams. Now fentanyl, we didn't use any of it, so we put 0. This just helps us check it off, make sure that all the accounting for the record keeping book, the drug log book is going to be intact, because clerical errors do occur, and we can then go back when we're counting drugs at the end of the month and make sure that everything is adding up if we have misadded and we can find the extra or missing medication that was dispensed from our inventory. So it'd be great, each one of you will have one of these cards attached to your paperwork, and we will help you fill this out when you get here. That's what our morning meeting will be about at 7 a.m. on May 31st. See you soon.